If there was an air hostess, I mean, she was applying for a cabin crew, she'd lost her job because she had pimples. Applying toothpaste on your pimples and landing up with bad scars or burns. These days, if you see youngsters, they're having a lot of junk food, they don't drink water, always on the phone, no sleeping. People, those who work on the call centers, they don't have any life. Like, there's no time for sleep, and they have dark circles. And they have accentuated lines. Like these children, they go in the rickshaws, the buses, trains and all, they're exposed to so much. So you have to take care of your skin in a very, very gentle way. चाहे आप अपने कपड़ों पे, जूतों पे, बैग्स पे, गैजेट्स पे, 2 व्हीलर्स और 4 व्हीलर्स पे कितना भी खर्च कर लें, अगर आपकी स्किन और हेयर रिच नहीं लगते तो आप पुअर हैं। आज अड्डा अनफिल्टर्ड पे स्किन केयर और हेयर केयर के बारे में बात करने के लिए मुझे ज्वाइन कर रही हैं एक्सपर्ट डर्मेटोलॉजिस्ट डॉक्टर Kalpna Sarangi. Hi, I'm Dr. Kalpna Sarangi, a consulting cosmetic dermatologist. You're watching Adda Unfiltered. Please subscribe, like, comment, and share it with others. And thanks for watching Adda Unfiltered. तो डॉक्टर कल्पना, व्हेन इज द टाइम कि हमें ये डिसाइड कर लेना चाहिए कि अब बहुत एक्सपेरिमेंट हो गया, होम रेमेडीज, हल्दी, बेसन सब हो गया, अब जो है डर्मेटोलॉजिस्ट को विजिट करने का टाइम आ गया, अब और टेस्ट नहीं कर सकते, वो कब हमें डिसाइड कर लेना चाहिए अपनी स्किन देखकर? वेरी इंटरेस्टिंग क्वेश्चन। एक्चुअली स्किन ऐसी एक ऑर्गन है हमारी जो कि एक्सपोज्ड है जी। सो हम अपने आप की तरफ से ट्रीटमेंट करते हैं, अपने मर्जी के हिसाब से जी, और दूसरों के हिसाब से भी हम ट्रीटमेंट करते हैं। लाइक एवरीबडी टेल्स, सपोज यू हैव अ पिंपल और यू हैव पिगमेंटेशन, यू हैव 10 people telling ये करो, वो करो, वो करो, वो करो। ट्रू। सो home remedies, I also recommend home remedies. I do it myself. But where to stop it and what to do as far as home remedy is concerned, you should have that knowledge. You should be that intelligent or that smart to know what is to be done and what is not to be done. जब तक सूट हो रहा है तब तक करो. Like for example, applying toothpaste on your pimples and landing up with very bad scars or burns, or applying some. You read on the Instagram and put some peels on your face. And I've had patient. There's an engineer and they're supposed to be educated people. He had put TCA peel on his face and he had come to me with burns. Oh my God! So, jitna ho sakta hai with the comfort of yourself and your skin, you do that much. But when you see that no, this is not helping me, my acne is not coming under control, skin बहुत dry हो रही है, skin बहुत dull दिख रहा है, skin में reaction हो रहा है, itching हो रहा है, dryness हो रहा है, burning हो रहा है, or like for example hair fall, that is also another thing which you keep on applying everything at home. And when we come to the doctor, it's very late, especially men, they come to us with like advanced type of male pattern alopecia. I tell them, why didn't you come earlier? So तभी आपको थोड़ा smartly डिसाइड करना होगा कि नहीं, मुझे अभी डर्मेटोलॉजिस्ट के पास जाना है। सो डिले नहीं करना चाहिए। अब जैसे कि बोलते हैं पिंपल आया तो मतलब जवानी आ गई है, बट पिंपल जो जवानी की निशानी नहीं है। देयर कैन बी इंटरनल प्रॉब्लम आल्सो बिकॉज ऑफ व्हिच आपके फेस पे पिंपल आ रहा है, जैसे कि किसी का स्टमक क्लियर नहीं है, बहुत सारे अंदरूनी प्रॉब्लम्स हो सकती है। तो कब हम ये डिसाइड करें पिंपल्स को लेकर कि नहीं, अब हमें जाकर पिंपल का ट्रीटमेंट करवाना चाहिए? See, पिंपल जो है ना, इट्स वेरी वेरी कॉमन प्रॉब्लम. इट्स नो मोर अ प्रॉब्लम ऑफ द एडोलेसेंट, जो कि जवानी में होता है पिंपल, वो नहीं है। आजकल तो एक एडल्ट ऑनसेट एक्ने भी है. So you get an acne at the age of 35 also. And sometimes, people, especially people those in the media, or those are using a lot of makeup, like, in the service industry, they also break out with pimples because of overuse of cosmetics, which is they have to do for their profession. So, कब तक आपने क्या पूछा, कब तक घर पे कब ये डिसाइड कर लेना चाहिए कि अब ये पिंपल का ट्रीटमेंट घर में नहीं करना चाहिए, और अब हमें जो है डर्मेटोलॉजिस्ट के पास जाना है? सी, एक दो पिंपल है तो आप कर सकते हो ट्रीट, only if it is not pustular, that means pus अगर है तो please come and meet us. So, like I'll give you a small example. There was this girl, young girl, 16, 17-year-old girl. She had alopecia. Alopecia means loss of hair. And she used to pull out her hair. So they came to me, then then I realized that she's got a lot of acne, pimples. So मैंने ना उसको कुछ नहीं किया, treat नहीं किया, मैंने उसका acne को treat कर दिया, and automatically her hair fall stopped. See, pimple can have so much of psychosomatic issues in your mind, so much of stress it can cause.
So pimple ka I will tell the parents not to take it lightly. So because I have seen like if there was an air hostess, I mean she was applying for a cabin crew, she lost her job because she had pimples.
Oh. Yeah.
So pimple is a very I would say an important factor in a person's life who has it. Young boys and girls, like I have seen parents had a pimple, तो है ठीक हो जाएगा, but ठीक हो जाएगा. But if you have too many pimples, what will happen is you'll end up with scars. तो आपको 25 by the age of 20-25 your acne will be under control because आपका hormone सब settle हो गया है. But what will you be left with? The scars, which will be there with you for life. And उसको treat करते करते बहुत time जाएगा. And sometimes you'll never get 100% result.
True.
That is why we insist that when your acne is there, I mean not grown out of proportion, treat it by a dermatologist so that you don't end up in scars.
Otherwise confidence lack हो जाता है.
Lack of confidence बहुत होता है.
True. And what are the kinds of pimples?
See, the kinds of pimples, there are 4 types of pimples. One is known as comedones. Comedones are again of 2 types. Comedones आप जो देख रहे black head और white head बोलते हैं, इसको comedones बोलते हैं. Then there will be pustular acne when pus form होता है. और एक acne है which is very severe type, that is known as nodulocystic. तो बड़े-बड़े pus भर के pimples आते हैं, that is known as nodulocystic acne. And there is another acne which is known as acne fulminata, that is very severe type of acne. like आपने steroid लगा दिया, too much of stress, और आपने बहुत सारा treatment कराया अपने आप, मतलब घरेलू treatment करके, you end up with lot of trouble. Like it's got secondarily infected.
So what are the remedies, like if you suggest like home remedies for pimples?
See, home remedies for pimple is like I would suggest like even when young girls or boys come to me, they have just grade 1 type of acne, I just tell them just use a good face wash which has salicylic acid or glycolic acid. That is it. That will be taken care of. Only when they are more acne or it can't be controlled and they are beyond 13-14 years, then I treat them. So you can use a topical agent. Grade 1 में topical agent, let's say topical antibiotic हुआ या clindamycin हुआ, benzyl peroxide, you can apply it. And then if it is grade 2 type, then you can use a little keratolytic agent like a retinol. And if it is a little severe with pus, then you need an antibiotic, and where you should take it with the doctor's advice.
So जो scar रह जाते हैं pimples के acne के जाने के बाद, उस scar को कैसे निकालें? Because it also takes time.
Yeah. So scar क्या होता है? Acne is like I told you, जब pustular हो जाता है, मतलब pus fill हो जाता है, it heals like how any other pus fill lesions would heal. With what? With formation of scars. वो scars जो होता है, ice prick scars या acne scars, that takes a little long time to go. Sometimes it doesn't go completely also. So उधर हमको treatment करना पड़ता है. Like you can do chemical peels, you can use products which are keratolytic, and you can use products which has retinol in it. Or we have a lot of treatments like lasers, growth factor like stem cells, and peels like I told you. Peels are very common. And so there are a lot of options available now for treating post-acne scars.
And doctor, what is the difference between those blackheads and whiteheads? They are actually...
Yeah, very interesting question, because many people think that blackhead meaning it's dirt. So what happens, whitehead is like a pimple. Pimple is formed inside, there is a gland known as a sebaceous gland. वो gland का एक duct है known as the pilosebaceous unit, जो कि open होता है on the surface of the skin. जब वो gland भर जाता है with sebum. Sebum is like oil which is secreted by the skin. So when वो gland भर जाता है, then it forms like a small
the edge is like
no, it forms like a small like खुरखुरा बोलते हैं ना, वैसा छोटा सा एक डॉट जैसा बनता है. But when that gland opens up and the sebum is oxidized, it becomes black.
Okay.
So it is basically sebum which is oxidized. It's not dirt. So कोई लोग बोलते हैं ना, चिढ़ाते हैं बच्चों अपने आप, देखते हैं स्किन कितना गंदा है and all that.
Blackhead
it's not dirt. I want to tell you, blackhead and whitehead are part of the spectrum of acne. So
what are the causes of blackheads and whiteheads?
Blackheads, acne. The cause of acne is basically hormonal. The hormone androgen causes acne in the form that what it does is it stimulates the sebaceous gland. So when the sebaceous gland, that is the oil forming gland, जिसमें कि हमारे चेहरे पे जो oil आता है, protects us and all that, when it becomes more produces more oil, then it forms acne. It gets blocked.
Okay.
And then that is how, and if it is blocked and you don't take care of it, then the surrounding the bacteria, they overtake it, and there is an inflammation inside. It is known as Propionibacterium acnes, which overact inside the gland. So it becomes infected, and that is how it is pus formed. Then it becomes pustular acne. And if you don't take care of that, it becomes big and it forms a cyst.
And what's the cause of these blackheads and whiteheads?
See, the hyperandrogenism or oversecretion of androgen hormone, it is usually genetic. So the kisi kisi ko hota hai, that's how we call acne prone skin and normal skin. So some people have the tendency of producing more oil. That is because their hormones are a little higher.
So are there any food habits, doctor, जो हमें थोड़ा take care करना चाहिए या hydrated रखना चाहिए skin को, जिससे कि those remedies if you can share?
Of course. See, what I suggest to my young viewers and my young patients is you have to lead a holistic life. These days, if you see youngsters, they're having a lot of junk food, they don't drink water, always on the phone, no sleeping. So this, I'm advising you. What you do is have a holistic life. What is holistic life? You eat your junk. I'm not saying don't eat, but along with it, hydrate yourself with water, at least 10 to 12 glasses of water you should have some fruits and salads with your food, so you get natural antioxidant, so we don't pump you with medicine. And then when you are hydrated, your pilosebaceous duct also gets hydrated. It doesn't get clogged with the stuck on the keratinocytes and the sebum and block the gland. So when you're hydrated, automatically your gland is also functioning well. तुमको acne भी आएगा नहीं. That is number one. Number two, sleep well. When you sleep well, cortisol levels are also maintained, so that your androgen hormone is secreted in the normal range. Okay, and to do some form of exercise, like any cardiovascular exercise, cycling, walking, swimming, yoga, whatever of your choice, football, cricket, you can do some form of exercise and drink. Like I told you, have fruits and salads. Homemade food you should have. Mostly prefer to have it, but once in a while, like twice in a week, you can have junk food, and avoid having colas and sodas,
aerated
drinks and caffeine. These days children drink a lot of coffee, especially during the exam. So please try and avoid it. I know it is a tough phase, all of you. I'm with you totally, because I also have a teenage son, and too much of stress for them, for the young children, so they break out in acne. So but you have to take care of your skin, and because this phase will go, this difficult phase will go, but you'll end up with acne scars. You don't want that, do you? So you have to take care of yourself, lead a proper holistic life, sleep well, eat well, drink a lot of water, have fruits and salads. Don't get angry with your mama if she forces you to have healthy food, and take care of your skin. And a few simple steps, steps of taking care of your skin. Wash your face at least 3 times a day. Hydrate it, like apply some moisturizer and a sunscreen if you're going out too much in the sun.
So pigmentation, it's another issue. Doctor, pigmentation क्या है और कैसे take care करें?
See, pigmentation is a big topic.
I know.
Like you can get pigmentation post acne also. That is another thing which I forgot to tell you. Acne के बाद pigmentation भी होता है. That is also very bothersome to the person who has to the person who has that pigmentation. Then there can be pigmentation because of sun exposure. You can get pigmentation because of hormonal changes like melasma, which is a very, very common thing which is seen in Indian women. And pigmentation because of some products you are using. And people, those who work out in the sun, like athletes and all, they also have pigmentation.
Sun tanning ki wajah se.
And people, those who have an OC pills like medicines, other medicines, they also sometimes get pigmentation. So in a tropical country like India, pigmentation is a big thing. And to be like, I have always been fighting this issue which people say in India, people think to be beautiful is to be fair is to be beautiful. That's not so. We have a natural, healthy, glowing skin. It's not necessary that only if you're fair, you're beautiful. No.
Whatever the color is.
Yeah. Whatever the color is, whatever you're born with, have that color, but preserve it. Take care of it so that you look nice, healthy, and your skin is glowing.
And basically, the skin should glow.
Yeah.
So, what home remedies for it? How to take care?
For pigmentation? Yeah. See, for pigmentation, again, like, hormones you can take care of by leading a holistic life. Like I told you, your sleep, your food, exercise has to be balanced. And of course, please don't take stress. It's very easy to say, but all of us take stress. You can do some breathing exercise. Like I always tell my patients whom I feel that they are going through stress, and especially when they're going through hormonal changes, that do some sort of exercise, breathing exercise like pranayama. It does help. And of course, you can do like home remedy for pigmentation. One can use some like honey is a good product for pigmentation. Honey, lime. Then basically the glycolic acid or the acids, fruit acid which we use in our treatment, they are extract from fruits. So some of it you can use at home, but don't overdo, because see, these are all peeling agents. Like milk also has lactic acid in milk and curd. That's why you must have heard that our grandmothers used to use a lot of haldi, and then besan, and then curd and milk, and they had a nice glowing skin because that was the lactic acid in it. So these days we get it in bottles and we use it on patients, or the patient use it themselves thanks to Instagram. They are self-educated, then they use it on themselves. So these are the things which you can use to a certain extent, but I would suggest don't overdo it, because most of the time what happens is they irritate the skin. When you're overusing it, you don't know where to stop. One thing which damage which we do is there's something known as the skin barrier that is damaged. When that is damaged, then it's very difficult to bring it back. It's not that we can't bring it back, but it's difficult. So ये जो घिस के लगाते हैं, like scrub, people use a lot of scrub. बेसन लगाते हैं.
I wanted to know that scrub use करना चाहिए कि नहीं use करना.
It depends on your skin type.
Your skin, no?
Skin type, yeah. If you have a very oily skin, you can use a scrub, but very gently exfoliate it, and the right product also you can use. But don't overuse, because what happens is you are damaging your skin. The skin is very delicate, and because of like these days, we have, because of urbanization, we sit in the AC a lot of time, or we exposed to the sun, or we exposed to the pollution. Like these children, they go in the rickshaw, the buses, trains, and all. They're exposed to so much. So you have to take care of your skin in a very, very gentle way.
स्क्रब अगर लगाना है तो कौन सा बेटर रहता है? लाइक होम रेमेडीज में अगर आप सजेस्ट करें, बेसन एज वी वर डिस्कसिंग इज गुड, और लाइक सम मार्केट का स्टफ?
Market ka stuff you can take, because sitting here I can't take any name of any product. I'm sorry, but you try and take a scrub which is of a good quality and invest in that. I always feel that you should invest in good skincare product. Yeah. Don't go for something which is just because somebody is told and it is less, pocket friendly. Don't go for that if it doesn't suit your skin. I'm not saying that all pocket friendly products are not good. Some of them are very good, but you have to choose.
But instead of spending later on, it's better to spend on a good quality stuff earlier. So scrub अगर use करना है, जैसे मेरी oily skin है या किसी की normal skin है, तो हफ्ते में कितनी बार use करना चाहिए?
You can use, if it's very oily, you can use it twice a week. But to be on the safer side, once a week.
Once a week only.
Yeah. And rather, I would say that you can use a mask which has Fullerza, that is Multani Mitti. You get very good packs these days, which are. So what happens? It absorbs the oil.
The oil, yeah.
And then after, keep it for 10-15 minutes, and then splash the rose water, regular water, and with circular movements, you just wash it off.
And does sunscreen really help? It does.
Yeah.
लेकिन थोड़ा बहुत, like मैंने देखा है sunscreen लगाने के बाद भी अगर आप beach पे जाओ, tanning तो होता ही है.
वो तो है. Beach with sunscreen application is very, very important. You have to apply sunscreen every 2 hours.
Okay.
And the amount of sunscreen you have to use is one fingertip, like this much of sunscreen you have to use for the full face.
Okay.
I mean, we don't use the amount which we are supposed to medically, we're supposed to use on the face. We don't use it for the full body also. So the amount of sunscreen we are supposed to use, and the number of times, like suppose you're out, you have to use every 2 hours. Who does it? I don't do it myself. So that is why you get tan.
Oh, that's why. Otherwise, you apply it once and you think, "Kya ho gaya?" It's umbrella or something.
But when you are going out, you apply it every 2 hours. Secondly, carry an umbrella, use a hat or a cap, and cover your face. I tell like children, those who go in the bike, or I tell them to cover their face, especially girls, with a soft, like a dupatta or a muslin fabric to protect themselves.
All right.
So that is called as physical sunblocks, like with clothing, with full sleeves and all.
But एक बार sun tanning हो ही गया तो कितना time लगता है उसे निकलने में?
If you have got a suntan when exposed to a holiday suntan, it takes almost 2 to 3 months.
2-3 months.
But otherwise, if you get a suntan, like just casual, see, there are 2 types of rays which affect us. One is a UVA and UVB. When it is UVB, which goes deeper, so that is why for that tan to go, it takes a little longer time.
But it has to be treated, or it will go with its own?
It goes with time, but people usually, there's peeling of skin, then it looks bad, it looks blotchy, it looks patchy, so people get a little agitated, so they come to us. So
जैसे tanning हो गया तो इतना stress नहीं करना चाहिए, it'll go.
See, either you enjoy and get a suntan, or sit at home and don't enjoy. I tell my patients, go have a fun and come to us. We'll take care of it.
We are there to take care of it.
One small nuska I'll tell you. Tomato.
Okay.
The pulp of tomato is very good for tanning.
Mm-hmm.
It contains lycopene, an ingredient called lycopene. And you take that fleshy thing, you just apply it on your skin, keep it for half an hour or so. It's very good for superficial tan.
So suntan हो गया तो उसके साथ wrinkles भी होते हैं?
It depends on the age.
Okay.
The suntan, not necessarily suntan, exposure to the sun, UV radiation. See, sun is not the only culprit. UV radiation, like your UV radiation from your phone, from your laptop, from these lights, from the ultraviolet radiation from these lights, then your sunbathing beds, all those things. And while cooking, infrared, you get that. So all these things give rise to exposure to UV radiation, which has equal effect as the tanning. The tanning.
It's not only the sun,
not only
which
the
is the
sun.
culprit.
So what happens? This UV radiation, they affect your collagen. They affect, so that what happens is fragmentation of collagen. Collagen is the network which keeps your the skin young or youthful, and so when that gets structured or that gets broken, then you get wrinkles. But if a small child is exposed, like for 13, 14, 12-year-old child, they'll not get wrinkles. But a person who is above 25, the chances of getting wrinkles are more.
So doctor, these days, it's not the age, young people who are working in the offices, like job मिली है और एक साल enjoy करते हैं, फिर इतना stress होता है कि forehead पे lines आ जाती है, laugh lines आ जाती है, crow feet आ जाते हैं. So it's not with age these days. What are the other causes of crow feet, lines on the forehead and the wrinkles on your laugh line?
See, there are two types of lines. One is the static wrinkles and one is dynamic wrinkles. Dynamic wrinkles are ones which are formed like when you are talking. Like when I'm smiling, I get lines over here. When I'm frowning, I get lines over here. That is dynamic because of movement. And static is already formed हो गया, जैसे nasolabial fold में हो गया और forehead पे हो गया. Like George Clooney has very strong forehead lines. So बच्चों को आजकल क्यों होता है? Because lifestyle. एक तो stress है. Second, food is not intake of food is not proper. Hydration is not good. They don't take enough proper vitamins. And exposure to pollution, the sun, and too much of AC. Like, people, those who work on the call centers, they don't have any life. Like, there's no time for sleep. And they have dark circles. And they have accentuated lines. Because skin is not hydrated. So I would advise all of you to keep on hydrating yourself, not only externally, not only internally, but externally also. How? By using a moisturizer, using a hyaluronic acid based moisturizer that will help you with your skin to maintain the moisture content of your skin. And
तो is it like जैसे कुछ लोग होते हैं चिड़चिड़े होते हैं तो हर वक्त गुस्से में रहते हैं तो वो भी एक रीजन होता है forehead पे lines का मतलब your personal own habits are
yeah, of course.
Some people I've seen they have a frown all the time तो it's like they do this तो वो पूरा यहाँ पे lines रहता है and the crow feet, not only people who laugh but people who frown at others. So
when people
is it your personal habits also?
Yeah.
Okay.
See, some people those who frown, they have lines. People those who laugh, they have laugh lines. And this lines also is accentuated. Yeah.
So crow feet is like it's with the age or like laugh line has also to do with it?
It is because of age and also because of habit.
Okay. So habit is also one of the reasons.
Yeah.
So when you see people who come with those wrinkles on the forehead, laugh lines, do you ask the history before treating?
Well, to a certain extent, yes.
Yeah, and you get to know the personality of the person.
Yeah.
Otherwise, crow feet to ek age ke baad ho hi jata hai. So how to get rid of them?
See, crow's feet is if suppose you're using a good under eye cream and you're using good moisturizer, how to prevent? See, aging starts from the age of 25. It's biological aging. It starts from the age of 25.
People think aging is like 30 plus ke baad. No. It starts from 25.
Yeah. And so you have to protect. That's why I'm telling this. I'm telling my main thrust is on for people those who are 14 plus, 15 plus and all that. Because see, these days their life is very stressful. And they have to take, earlier I used to never take care. I used to just use some home remedy. I was very good at home remedy. I used to do a lot of that. I didn't know that I'll become a skin specialist, but I was always interested in doing this, doing that on my face. So you have to take care of your skin. Hydrate yourself internally, externally. Eat the right kind of food. Keep yourself moisturized. so that the chances of your skin aging prematurely, you can prevent it. And have antioxidants, either in the form of your fruit salads or a, a tablet. You can do that, but I insist that you have your natural form of antioxidant. So you're preventing, you cannot prevent aging, you can delay aging. So that is what. And once you get it, you can use some creams, you can use
Massage your face.
massage. To a certain extent it will help you, and then otherwise we have treatments for that.
So doctor, people think कि skin हो गया, बाकी makeup हो गया, but lips को लोग ignore कर देते हैं. Women they think कि lipstick लगा लिया हो गया, and men they think कि ठीक है थोड़ा gloss लगा लिया या Vaseline लगा लिया हो गया. But dry lips, why and how and what are the remedies?
Yeah, the causes of dry lips are many. One is dehydration. One is not taking care of it. One is allergy to the toothpaste you're using.
Okay.
And one is people have the habit of licking their lips. That also causes dryness and chapping of lips. Vitamin deficiency. And some, especially females, the reaction to the cosmetics they're using, like the lipstick or the color. Because if I have mostly seen darker the lipstick, it contains iron oxide, so that might cause a little bit of reaction on the lips. And the quality of the lipstick, it has to be really good. It's a gloss or a lipstick, it has to be good quality.
Is it too with some stomach related issues also? Like अगर आप कहते हैं अगर आपका पेट साफ नहीं हो तो आपके lips फटने लगते हैं.
See, that is because your vitamin deficiency.
Okay.
Vitamin deficiency, you're not having enough water. So all this adds to it. Okay. Basically, skin is lips are like skin only. So it has to be hydrated. So that is why you get a chapped lips.
So for the total your skin and lips के लिए क्या एक lifestyle आप maintain करने के लिए advise करेंगे?
See, besides I've already been repeating the holistic lifestyle. Besides that, you have to wash your face at least 2 to 3 times a day. Then use an active like a serum which contains either vitamin C, hyaluronic acid, arbutin. Depending on if you have pigmentation, you can use kojic acid. Combinations we have of serum. Then use a moisturizer and then a sunscreen. That should be your routine for the day. And in the night, instead of the sunscreen, you can use, if you have mature skin like above 25, you can use a product which has retinol in it, and make sure that your products have hyaluronic acid in it, because hyaluronic acid not only hydrates the skin, but it is a natural ingredient of the skin in all species. So it maintains a balance. It keeps your skin hydrated, supple, and gives a nice glow to the skin.
So this is it for the skincare routine.
The basic skincare routine. If you have a problem, then it will be different. And it will be customized.
True. So what about anti-aging stuff which you recommend?
So anti-aging has blown the rooftop. There's so many things in anti-aging. Sometimes I have children, 18-year-old girl, she came and told me, Doc, I'm finished. I've got wrinkles. I said, where have you got wrinkles? And she's calling her laugh line wrinkles. Okay. And she was so distressed. I laughed it off, but for her, it's a problem. When she's seeing it as a problem. And it's so much there in social media is actually making it so big, anti-aging. So children are getting confused. And so are adults.
True.
So there are various type of anti-aging treatment which is popular these days. To name a few, we give toxins like botulinum toxin for wrinkles, like we're discussing. For the dynamic wrinkles, the wrinkles which is formed because of expression, can be taken care of by botulinum toxin. And the static wrinkles which is already formed, like this laugh lines, this furrows, or this under eye, the hollow,
squinting, frowning, as you said,
or lifting of the face, you can use a filler. Then there is threads also to lift the skin to look younger. And then we have stem cells or growth factor concentrate. Then the lasers, various type of lasers.
Do you suggest the skin tightening devices? Which ones are the ones?
See, the ones are, we have lasers. Then we have HIFU, which is high intensity focus ultrasound. And then these are the few, and Exilis is one of them. Again, radio frequency, MNRF, and microneedling. These are the things which are used these days.
Also?
Injectables like
After
fillers.
What age?
See, like a lip filler can be done at any age. Like, suppose somebody is in the media or suppose somebody is in acting, you can do a lip filler after the age of 18 or so. This is basically, they're safe products. But there is a certain age to do it. And toxins and all depends on like what type of wrinkles you have and where you have, what is your profession. So it depends on that. It starts very early in people those are facing the camera or those in the service industry. But otherwise, after the age of 25 is quite safe.
Is suggested. And any side effects?
Side effects, I would say it is an injectable. If it goes to the wrong artery, if it goes to the wrong place, then it can be disastrous. And if it is placed at the wrong place, also it will look very bad. If you place too much of product, it will look very bad. If you do too much of toxins like botulinum toxin, then you'll have no expression. Then you'll have a deadpan expression. So these are the side effects, and it can as other things like if you do it by an untrained person, then it can go wrong. There can be infection. There can be misplacement of the product, an asymmetry of the face. Your smile can become lopsided. You can get a drooping of the eyelid also. These are the various things.
And this is my personal question which I wanted to ask. Bleach करने से भी skin tanning हो सकता है क्या?
Skin tanning नहीं होगा. Bleach is actually, people think bleach करने से fair दिखेंगे. When you're bleaching, you're only bleaching a facial hair.
True.
The fine hair you're bleaching. So automatically you look fair. But when you're bleaching, you are damaging your skin in the sense it's very drying. So you can, you'll not get tan, but you'll get the skin will become rough, it will become dry. You might get irritation. So that is how, and if you over bleach, then if the skin peels unnaturally, then you'll get pigmentation.
Yeah. So bleach करना चाहिए नहीं करना चाहिए? It's advisable through an expert.
Through an expert, if you're using a very good bleach, you can do it once in 3 months. But not like people do it every month.
Every month is not advisable. Once in 3 months is enough. Okay, that's why I suffered this once. I wanted to know. And this is for everyone to know that once in 3 months is advisable for a bleach and a good quality bleach. And preferably, you should go to a salon and get it done from an expert.
Yeah. Try not to do it at home.
So, doctor, we spoke about laser. You spoke about it. What is the most commonly used laser treatment, like especially for hair removal?
Yeah, like you said, rightfully, laser, which is most commonly used, is the laser hair removal machines, which is very popular, and it's so popular that it's done in beauty parlors also these days. And like when we started, we were like me and a few other 4-5 other doctors in Bombay were the first ones who did the topmost laser, which was a diode at that time. But now that was a single wavelength laser. Now we have a triple wavelength laser, which is the latest technology. So laser hair removal is very simple and very, very, very common. Everybody wants to do it. And they're not only dermatologists do it, but there are a lot of other non-dermat doctors also doing it, which is fair enough. And they do it in salons also. What my only advice is, get it done from people who are trained. Because it is a machine. And the machine's capacity is tremendous. And only if it is done by a proper trained person, it will give good results. So even if you're doing outside, make sure that you get it done from proper machine. There's a lot of Chinese and Korean machines floating in the market. So try to avoid those, because what happens, like the cost between a laser hair removal done by a dermatologist and the cost done by a non-dermat or a
beauty parlors
are totally different. So people come and ask. This is the very commonly asked question: why is it expensive? Why I'm getting it done at 1/4 the cost somewhere else? But take your choice. I'm not saying that come to me, but wherever you're getting it done, make sure that the person is trained and the machine used are also good. Because this is like, how you go and do a facial or a haircut, laser hair removal has become that common. In fact, people are coming home with the machines and getting it done.
But you get it back, the hairs, if you do for the sasta stuff.
Yeah, obviously, if a machine is costing you 46 lakhs and another machine costing you 3 or 4 lakhs, so the quality will be different.
Yeah. So there's this saying that, what was that I had mentioned to you, that महंगा रोए एक बार, सस्ता रोए बार बार. It's that way. Because now my friends, who get it done in parlors and all, again they get them back. And then they again run and go for the laser. Then I ask them कि फिर क्यों करवाया था जब वापस जाना था इतना frequently. So as you rightly suggested, that one should go to a dermatologist, a good expert.
Even if not dermat also, I'm saying, like, obviously we do it maximum and we have the best technology. But if you're getting it done from somewhere else, make sure that the machine is good, the person doing is good, and they're trained. So be smart in deciding where you want to go.
So skin means people think only skin, hair is important. What about nail? Nails are also very important. What about nail hygiene and nail care, doctor?
Yeah, nail care is like, like I told you, skin, hair, and nail are our forte. So these days, a lot of people do manicure and pedicure. Even men also are doing it. You do it. I'm not saying that don't do, but don't do overzealous manicure pedicure, and don't do too much of this gel nails, because what happens is you're stripping your nail of its natural oils, and you're stripping it of your natural cuticle, which is protective to the nail plate. Then you'll have problems like thinning of the nail, breaking of the nails. And if you are using too much of water or too much of detergent, like you see in housewives or people those are doing a lot of washing, like
household work.
Household work. Like today, one car wash man had come. He's getting very bad infection on his nails because he's washing so many 20 cars in a day. And hairdressers I've seen, because they can't help it and they can't wear gloves and cut the hair. So this is a professional hazard for so many people. So be careful about it. And because what happens is when you're using too much of water, too much of detergent, like when you use in hair products, then you're stripping your nail of its protective layer, and you end up in fungal infection, which is known as paronychia. So you have to do that, and trim your nails time to time, and keep your nails clean, and have proper vitamins. There are certain vitamins for the nails also, like biotin. So you have to take that so that your hands and feet also look as pretty as your face.
Nails hygiene is equally important. What about those artificial nails? Women these days, itna lamba chudal jaisa nakhun. Sorry to say that. Even I have tried once, but then it was very difficult to maintain. But then you naturally have good hair nails. उसके ऊपर इतना लंबा नाखून लगाने का, and then उसके बाद वो ये जो original नाखून होता है उसके ऊपर इतना product लगता है कि वो खराब हो जाता है.
Yeah. So it is a fashion. Yeah, it is a fashion. So we cannot say anything about fashion. So
I also did that.
Yeah, I have also done a couple of times.
I don't know.
But I burnt my fingers literally, so I don't do it.
Burnt her fingers.
So, I would suggest that you do it for occasion or something, but don't do it on a regular basis, because there's a glue which you have to use to stick on those nails.
Glue is bad.
That damages your natural nail plates. So be careful and be smart.
So doctor, people say कि बृहस्पतिवार को बाल नहीं धोना, हफ्ते में 2 दिन धोना, कितना दिन धोना बाल, कैसे धोना, which shampoo to use, and hair के बारे में बताइए, complete routine क्या follow करना चाहिए?
See, hair is something, some people take extra care and some people don't take care. People those who don't take care, they wash their hair only once a week, which is not done, and especially in a place like Bombay and a place like India, tropical country, we have to wash our hair at least thrice in a week. Otherwise, what will happen is there will be a collection of your own oily secretion from the scalp. Plus, if you're using any product, that also gets deposited on the scalp. Secondly, there will be a nice place for your dandruff to grow and to happen. So the routine should be thrice in a week hair wash, and use a gentle shampoo, preferably a sulfate-free shampoo. And if your hair is dry or colored or curly, you can use like mine. You can use a conditioner. People those who have silky hair, they can escape. And men don't like to use conditioner, but again, people those who have curly hair can use a conditioner and a hair product. I always tell, especially when they're growing up, children don't want to apply oil. Then the mothers, they come and tell me behind their back, tell her to use oil. She's not using oil. I'll tell you, oil is like a conditioner. So if the child doesn't want to put oil and go to school, please let the child be. If you apply oil 3 to 4 hours before hair wash, it's good enough.
It's fine, no?
It's fine. Apply oil because that naturally conditions your hair. And when you're growing up, you don't want to use, see, all said and done, we can say sulfate free, this free, that free, but they are chemicals. So that is why you can be as natural as you can while the child is growing up, and after they grow up, they'll not listen to you. And it's also convenient to take something from the bottle and use it. My mother used to use methi and kacha doodh to wash her hair. She started coloring her hair at the age of 60.
Oh, yeah. Methi and kacha doodh.
She used to soak it overnight and make a paste of it, and it's a nice detergent.
Oh, okay.
And wash, and she has this big hair, this long hair. Lovely hair she has.
So people who color their hair, they think कि बार-बार wash करेंगे तो color चला जाएगा, फिर से color लगाना पड़ेगा. Is it true?
That is true. That is true, but then you have to either, stay with the dirt and encourage hair fall and dandruff, or
color again.
Yesterday only I had a patient. She said, I'm washing my hair once. I said, in a place like Bombay, you can't afford to. And the worst is, what people do? That's one very good question you asked me. Suppose they've colored their hair, they don't shampoo it that day. They some beauticians also promote it. They shampoo it the next day. So can you believe that that chemical that is PPD, it is there in a scalp for 24 hours? How much damage it must be doing? See, if you just wash it without any shampoo, there's a remnant of the chemical in your scalp. So it causes a lot of damage. I've seen a lot of people coming with severe hair fall, severe reaction on the face, on the neck, because they've kept the color for a longer time. So you must wash your hair.
And about the shampoo, doctor, people say कि जैसे फेयरनेस की क्रीम का एडवर्टीजमेंट था कि ये मर्दों वाली है, ये औरतों वाली है, तो शैम्पू का भी ऐसा होता है क्या? कोई मतलब मर्दों के लिए अलग होता है, औरतों के लिए अलग होता है? शैम्पू anybody can use any shampoo. See, these are basically marketing gimmicks. Like, ये shampoo इसके लिए, वो. Of course, for children, there are certain shampoos which are for mild shampoos, which doesn't have too much of detergent. When you have a sensitive scalp, you use that shampoos which are sulfate free, shampoos which have additives in it. So there are different type of shampoos, for different hair types. But like male, female, like that, there's nothing like that. And what is the cause of split ends? Split ends is again too much of use of color. Okay. And not hydrating your hair. It is like a part, like how you take care of your skin, you should take care of your hair. Hydrating in the sense oiling your hair, or using a good conditioner, vitamin deficiency. These are all reasons for it might be a simple thing, doctor, but then correct way of combing your hair also matters. Yeah. What happens is when you comb your hair, when your hair is, and very rigorously comb your hair when it's wet, then you're stretching the bonds, the sulfide bonds. Hair is formed by sulfide bonds, so you're stretching it. So the chances of it breakage is there. So what you do, you can comb your hair when it is damp, but use a wide tooth comb. Okay. And comb it. But some women, they say कि गीले बालों में कंघी करने से naturally straightening हो जाता है, then you don't have to straighten it. तो गीले बालों में कंघी करनी चाहिए कि नहीं? Like I told you, damp hair में कर सकते हो, but then use a wide tooth comb so that you are not giving tension on the hair. So doctor, about dandruff, which is very very important to know कि dandruff कैसे होता है, क्यों होता है, और कैसे इससे हम निजात पाए. See, dandruff is a very very common problem, and it's an age old problem. And there are two types of dandruff. एक तो wet dandruff है, जो कि stick on waxy हो जाता है scalp पे, and it becomes itchy also. And there's a dry type of dandruff where it falls on your shoulders and it comes out with your fingers, or when you're combing, वो भी सफेद सफेद भूसी जैसा बोलते हैं लोग, वैसा होता है. So dandruff is basically the dryness of the scalp. And there's this organism known as Propionibacterium ovale, which is the causative organism for dandruff. And same species is also responsible, like Propionibacterium acnes is responsible for acne. That's why जब dandruff होता है, then we'll see acne, especially इधर, बहुत जन को इधर acne हो जाता है, back पे acne हो जाता है, इधर भी acne हो जाता है. These are acne prone areas. So dandruff and acne are also interrelated. That is one more thing which I wanted to tell you. And secondly, जब आप बाल ठीक से नहीं धोते हो, like we had discussed earlier, if you don't wash your hair regularly, like every 2 to 3 days, then there is buildup of these dead cells, and then the bacteria overworks over there. Then dandruff becomes more severe. So that is why you have to keep your scalp clean, hydrate yourself, and if you have dandruff, then use an anti-dandruff shampoo. And whenever you are using a shampoo, make sure, and if you have your scalp is acne prone, see, everybody will not have dandruff. Some people will have, but unfortunately, some people is almost 60 to 65% of the population. So when you're using a shampoo, use your fingernails to just scrub it. Scrub करके बाल wash करना है. Keep the anti-dandruff shampoo for 5 minutes and then wash it using your fingertips. And then after that, usually all anti-dandruff shampoos are little harsh. So the hair becomes very dry. So after that, use a good conditioner. And doctor, what are the products and what are those things which we use can lead to skin cancer? Actually, the product which is commonly used, which has some scientific basis of causing skin cancer, is sunscreen. But you have to use so much of sunscreen, like how people use in Australia, those who are into sunbathing and all, they use they bathe in sunscreen and all that. But we have never seen that in India because A, we don't use so much of sunscreen, B, we don't have that kind of lifestyle.
Another thing which can cause cancer is your hair dyes.
Yeah, I
Yeah,
wanted to know.
that
Shampoos, no, only the
No.
hair color. Hair color and sunscreens can cause cancer.
that to a certain extent,
To an
theoretically
extent.
yes, yeah, theoretically yes, but very 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 rare. जैसे basically देखा जाए तो कुछ भी can cause cancer
actually.
these days. Like any type of, we are eating so many fruits and vegetables. The pesticide in it can also cause cancer.
True. So to take out your makeup, like after you visit a party or like people who work in media and all, these days every third person is a YouTuber and is on social media. तो मेकअप निकालने के लिए और हेयर के जो प्रोडक्ट्स होते हैं उसको निकालने के लिए ऑयल अच्छा है या क्या सजेस्ट करेंगे आप?
See, makeup removal is again very interesting question. What happens is हम लोग आ जाते हैं घर and we're tired. I've seen so many people, educated people also.
And they sleep with makeup on.
Sleep with makeup, and this is like torture to the skin. Yeah.
In the hair, yeah.
So you have to remove the makeup. If you're using oil, fine. Otherwise, there's something known as very skin-friendly product, which is known as micellar water. Excellent for makeup removal. I would advise that. Even after using all that, wash your face. And then use your...
some people, they suggest coconut oil or olive oil.
Suppose you're using very heavy makeup, like makeup used by people those are facing the camera, you can use coconut oil, baby oil, or Johnson baby oil they use, mineral oil.
True.
Johnson baby oil I'm not supposed to say. So mineral oil, you can use that to remove your makeup. And then after that, wash your face with warm water, because the oil which is remnant in the skin can cause acne. It will irritate your...
True. And for hair, like, you use products and sprays and all. So,
see, hair, what you can do is, now oil if you put, then it is going to, it will go in further. You can just use a warm towel and then wipe it off. Yeah.
And wash
it the next day. Washing it the next day is more practical than doing anything in the middle of the night.
But like, as you said, like, makeup you're wearing and you sleep with the makeup on, the same goes for the hair also.
If you have professional hair products, you have to wash it.
You have to wash it. Otherwise, you can wait for a day with the towel will do.
Yeah. You can wash it the next day if you're too late.
Makes sense.
Come back home early and wash your hair.
So thank you so much, Dr. Kalpna, for sharing such important and necessary tips with our audience. It was a pleasure talking to you, and thank you for being a part of Adda Unfiltered.
Thank you so much. It was a pleasure talking to you. And you made me feel very much at home.